You know, in the world of healthcare, every single second counts. Decisions get made in a flash, and clear communication isn't just a nice to have, it can literally be the difference between life and death. Okay, so let's dive into a tool that's designed to make those critical moments a whole lot safer.
Think about a busy hospital, right? You've got complex patients, different teams of specialists. Every single word has so much weight. I mean, you misunderstand an order, you delay a report, and the consequences can be, well, pretty serious.
So, what happens when all that communication just fails? That's really the big question we're digging into here. And yeah, the answer is pretty stark. Patient safety gets thrown right into jeopardy. All right, so let's see how this actually plays out in the real world. It turns out research shows there's this huge and frankly dangerous communication gap between healthcare professionals, especially between nurses and doctors.
And this quote, wow, this really gets to the human side of the problem, doesn't it? This is from a real nurse, and it's not about a medical mistake. It's about feeling scared, dealing with a hierarchy, and then just avoiding the situation altogether. And you can see how that just becomes a massive barrier to good patient care.
And look, this isn't just about feelings or someone having a bad day. The research points to some really clear, recurring themes. You've got everything from a nurse's readiness and crushing workloads to things like a doctor's attitude. And even something that sounds so simple, like messy handwriting, which makes people terrified of making a mistake.
Okay, so with all this complexity, what if I told you there's a simple, structured solution to cut right through it all? Well, there is, and it actually comes from a totally different field, one where clear communication is just as critical, if not more so.
Yeah, this tool wasn't invented in a hospital. It was actually created by the U.S. military for nuclear submarines. I mean, can you imagine the stakes there? A miscommunication could be catastrophic. Then, the airline industry picked it up and perfected it for the exact same reason. So you know right away this thing is battle tested. And that tool is called SBAR. That stands for Situation, Background, Assessment, and Recommendation. It's basically a simple, standardized playbook to make sure information gets passed along clearly, quickly, and completely. Every single time.
So, how does this thing actually work? Let's break it down. We're going to go step by step through each part so you can see how it creates this really predictable, organized way of sharing critical info. All right, first up is S for situation. Think of this as the headline, the tweet. You've got like 10 seconds to say who you are, which patient you're talking about, and what's happening right now. It just grabs their attention and sets the stage immediately. Here's an example.
Mrs. Smith is breathless and her heart rate is at 130. She may be having a transfusion reaction. See? It's perfect. It's so direct, right to the point, and you feel that urgency from the jump. Okay, next up is B for background. Now this is where you give just the key relevant context. We're not talking about the patient's whole life story here, right? Just the specific clinical stuff you need to make sense of the situation.
Wow, now look at this example. It's so powerful. He was in an auto accident last Friday and his wife was killed. The background to here isn't just the medical chart. The fact that his wife was just killed, that's absolutely critical information. It just goes to show you that the background has to include the whole person.
Okay, third step, A for assessment. This is where you, as a professional, state what you think is going on. You've laid out the situation, you've given the background. So what's your take? What's your analysis of the problem?
This is a great example. He may be having a pulmonary embolism, coronary artery disease, or a cardiac event. It shows the person talking has put the pieces together and is offering a clear professional judgment based on what they're seeing.
And that brings us to the final letter R for recommendation. Honestly, this is the whole point of the call, right? What you actually need the other person to do. And your request has to be super clear and something they can act on right away. For instance, I recommend you see him immediately and start him on O2. Perfect. There is zero ambiguity there. You know exactly what's needed. You know it's urgent. That's how you get things done.
All right, so we've got the theory down. Let's put it into practice. We're going to walk through how SBAR works in a really common and super serious medical emergency, a hypertensive crisis. Okay, so a nurse's protocol for dangerously high blood pressure is pretty standard. You take the vitals, you check the symptoms, but the real make or break moment, the part that gets the right help fast, is step 3, taking action with an SBAR report.
So let's build that SBAR report right now. For the situation, we've got a sky-high blood pressure reading, plus some really alarming symptoms like a bad headache and chest pain. For background, we give the key context. He's here post-op, we know he has a history of hypertension, and we know what his normal blood pressure looks like and the meds he's on. Okay, now for the A and the R. The assessment is straight to the point. I am concerned about a hypertensive crisis, maybe even worried about a stroke or a heart attack, and the recommendation is crystal clear. I recommend you see the patient immediately. And notice that proactive question, should I get an EKG and some labs? That's a complete, super effective piece of communication. So, why does all this matter so much? I mean, really, let's just do a side-by-side comparison. You'll see just how massive the difference is between a chaotic call for help and a structured SBAR report. Okay, so look on the left. You've got this frantic, vague call for help. Yeah, it sounds urgent, but there's almost no useful information there. The doctor's going to have to play 20 questions just to figure out what's going on. Now look at the right. With SBAR, you get the entire clinical picture in, 30 seconds? It's calm, it's professional, and it gives the doctor everything they need to make a decision and take action. The difference is it's night and day. And that really brings us to the final thought here. When everything is on the line, when every second counts, a simple tool like this isn't just best practice, it's a lifeline. So I'll leave you with this question. In that life or death moment, how would you want your team to be communicating?